If you want the results of a chemical peel without the chemicals, this next thing may be the option for you.
Hi, I'm Julia. I just started a business and I want to look fresh and young. I'm going to be in front of clients on a weekly basis, so I don't have the time, nor do I have the money for a big chemical peel. I spent years in the sun in Florida and it damaged my skin, so I spend lots of time buying face products and creams to improve my skin. I'd love to have some kind of treatment that would be something I could get back to work the next day. Could you recommend a treatment that would give me A-list skin without breaking the bank?
Well, funny you should ask. Dr. Orton is backstage with dermatologist Dr. Glynis Ablon. They're going to reveal a brand new chemical peel that claims to avoid all the redness afterwards. So Dr. Orton, take it away.
That's right, and Dr. Ablon was nice enough to bring Julia with her, who you just met. Now, Julia has a couple things going on in her life, starting a new business, just turned 50. And she's interested in getting a little pick-me-up, a facial rejuvenation, resurfacing, but does not want to go through the expense and the downtime of a more intensive resurfacing procedure. And, you know, just to comment on Cyndi Lauper, it looks like she probably had a more invasive either peel or laser treatment, and that look is pretty normal if you do go deeper.
Right, and that lasts about 2 weeks at least of the redness. And
but today,
so I have to ask, you know, you're saying that redness is kind of normal. Do chemical peels normally hurt? Is this a painful thing? Because it looks painful.
Chemical peels can hurt. It depends on the degree of the acid that you're using, whatever concentration. So some can hurt significantly.
Right. Just like the degree of a sunburn. Does a sunburn hurt? Well, if you get burned pretty badly, you will hurt. So either a deeper peel or laser resurfacing can be painful, but you have an alternative that you brought with you today,
This is actually the NanoLaserPeel, and what we're going to do is we're going to go ahead and we're going to start our little machine here. And we are going to do, we finished most of the face now. We're going to finish up the last couple pulses here so you can see what it looks like. And here we go. This is it, and that's it.
Oh.
And that's it. And so she's completely done now.
What were you feeling with that laser?
It felt like a hot sensation. It was actually very simple. And I can't believe how quick it was. It was very painless, and I'm excited to see my new face.
And how is this different from other lasers with the nanotechnology?
So this is actually an erbium laser. So this is a resurfacing laser. This is an ablative laser, but we're using different microns to actually pick how deep you want to go in the skin. And then she'll have a little bit of redness there. The whiteness will actually go away when she wipes her face. She'll be good to go in a couple days. She'll look completely normal. Her skin will glow. There'll be new skin, rejuvenation, and she actually stimulates these messenger proteins to make new skin.
How often should someone consider having something like this done when you talk about a peel or a laser resurfacing?
So it really depends on the skin type. That's the most important thing. What kind of sun damage you have or what your goal is. If we're treating acne scars, we'll get into a much invasive laser. That's where something like a deep acne scar, we would need an erbium resurfacing laser, a deeper one to actually improve the scars themselves.
To answer that question, we've got something for everybody, depending what the age and what the specific problem is. But let's take a look at Julia, how she looked before and now how she looks after this nano laser treatment today.
The entire face was treated, and you can say she's just a little red, a little bit of whiteness. It should be good to go. She'll have no real downtime.
And Dr. Ablon, you brought some other pictures with you today of
typical
results after some time. Let's take a look at those.
That's fantastic.
And we were talking earlier in the show about how if you get a procedure done by the wrong person or at the wrong facility, a lot can go wrong. We don't know what was going on with Cyndi Lauper there, but if you're thinking about having something like this done, what should you look for in terms of someone knowledgeable using this type of equipment?
Typically, these kind of ablative lasers, you do want a physician doing them. These are ablative lasers. You can have complications. So you want an MD that has been trained in lasers. It's nice if you have someone who's a fellow, the ASLMS, which is a laser society, and that's someone that's really qualified.